Alpha Day and good afternoon. The Committee on General Government Operation, Appropriation, and Housing is now called to order. For the record, today is Tuesday, May 3rd, 2022, and the time now is 2 o'clock. Notice for this budget hearing were disseminated via email to all senators and all main media broadcasting outlets. First public notice was issued on April 4th, second on April 28th. The committee will now hear Bill 276-36 COR, Committee on Rules, by the request of I Maga'hågan Guåhan, the Governor of Guam, in accordance with the Organic Act of Guam, an act making appropriation for the operation of the executive branch of the Government of Guam for fiscal year ending September 30, 2023, making other appropriations, establishing miscellaneous and administrative provision relative to the Guam Behavioral and Wellness Center. Acknowledgement of my colleagues that are present today. We have Senator Tello Taitagui. I know the Oversight Chair, Speaker Therese, is on her way. Those testifying on Bill, the general rules of this budget hearing is that those testifying on Bill 276-36 CR relative to the Guam Behavioral Health and Wellness Center are invited to the panel. We have the Director, Teresa Ariola, with her staff, Debbie Polino, and Carissa Pangilinan. Thank you for joining us this afternoon. Written testimony shall be submitted to the committee. Please provide my legislative staff with your written testimony for photocopying. Testimony may be read, and lengthy testimony should be summarized to about 5 minutes. But Ms. Ariola, you have all the afternoon. We're only going to hear you guys, so hopefully it doesn't last that long, but you know. Those testifying be allowed to present oral testimony. Once you're done, please remain in the room for questions or for additional testimony as may be desired by members of the committee. Question and testimony shall be confined to the substance or nature of the agenda, which is we're here to discuss the budget for Guam Behavioral. Personal inference as to the character or the motive of any senator or any individual testifying is not permitted. Any violation of this general rule of conduct will result in removal from the budget hearing. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and will be removed from the room. When you speak, please make sure the microphone is on, that you speak into the microphone. Other questions may be submitted to the committee for submission to the agency or department for responses. Please state your name and title for the record. I'd ask the Sergeant Arms to ask the panel to please rise and you'll be sworn in for your testimony.
Please raise your right hand. Under penalty of perjury, do you all affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth, so help you God? Mr. Chair, under oath, you may proceed.
Thank you, Sergeant Arms. I'd like to also recognize my colleagues that have joined us this afternoon. We have Senator Amanda Shelton and Senator Joanne Brown. I'll now ask the Director to please provide your budget to us. Please, thank you.
Thank you, Mr. Chairman. Senator San Agustin, thank you, Senator Amanda Shelton, Senator Joanne Brown, Senator Tello Taitagui. Thank you for taking the time to be here. I appreciate it. You should receive a copy of my presentation, and we can just get started. Mr. Chairman, if you wish. Okay. So first of all, thank you for this opportunity. I want to just say that today is May, and it is in celebration of Mental Health Month. So whether it's a coincidence or not that I'm being heard before you in May, it's all good. So May is Mental Health Month, and so I ask you and everyone on the island to recognize it and promote the fact of the awareness that May is Mental Health Month. And I will talk about a lot of the events at the end of the presentation, the budget presentation, but we do have an array of events to celebrate and to bring awareness to May Mental Health Month. The first slide, please. I'd like to start with the highlights of the department. I'm pleased to state that we have received CARP recreditation. It was granted in August of last year, and it's for the period of 2020 to 2023. Even though, Madam Oversight Chair, Madam Therese Terlahi, thank you. So CARF, we received CARF accreditation. We were told in August of 2021. It is for the period of 2020 to 2023, so already the department is preparing in preparation for the reaccreditation process for next year. Another highlight that I'd like to bring to everyone's attention is the renovation of the cottage homes, which will be additional 30 beds, and the construction of the permanent drug and alcohol New Beginnings building. The anticipated RFP announcement is of this month. I've been tracking it, and it's just at its final review in the AG's office. Another wonderful highlight is the Guam Psychological Doctoral Internship Program. And that is a program that our governor I proposed to the governor last year. She found the investment money. We are in partnership with WICHE. And this program will allow fourth-year doctoral programs in psychology to do their internship program here on Guam. And as they do that, we will be able to offer them a position right after that. So I am pleased to say that we have 2 candidates slotted, and one of them is a local girl, a local candidate. So this is the whole purpose of the Psychological Doctoral Internship Program, is to provide opportunities for our local students, our local residents who are pursuing the path of psychology, to be able to come to Guam, do their internship program here on Guam, and immediately be able to be offered a position. And so we're very happy that one of the 2 is a local person. Another highlight, and I know that we don't really highlight this enough, but you know, besides individual services to individual folks, Guam Behavioral Health has provided 22 community trauma response debriefings. What is that? That's when the community, specifically departments or companies, their employees have undergone a trauma or a situation in their workplace. And so we have trauma response team that responds to their request. And so that is to help debrief the employees of that department or that company based on the trauma that they experienced, whether it's a death of an employee or sometimes a very tragic death of an employee. And so they have a hard time processing that because it's a colleague of theirs. So I'm happy to report that 22 since last year has been performed. And another highlight is the increase in federal grants awards, which you will see in later slides. Next slide, please. Before you is a synopsis of Guam Behavioral Health and Wellness Center services. The items in bold are new or significant this year. Under crisis services, crisis hotline, as you know, is ongoing. That's not highlighted, but mobile response is, and that is a program where we respond to the individual in their home or in the community. That and Warm Handoff Peer Services is highlighted as a new program because they are currently in the pilot process and in a couple of months should be implemented fully. Again, I just mentioned community trauma response debriefing. Down in the criminal justice program, or commonly known as the mental health and substance use program at Department of Correction, inpatient services I highlighted because that is something that a lot of judges and everybody is aware of, and where our services are mainly concentrated in. Nursing services, what's new is the COVID vaccination clinic, what happens every Thursday. So if any of you, senators, or your employees, or any one of the people of Guam need to get vaccinated, we offer this service every Thursday. And so please let us know. COVID testing and mitigation is ongoing for clients as well as staff. Under the Prevention and Training Division, something that I'm very excited about is the school-based youth referrals for suicide intervention, or what is commonly known as the Safe School Guam app. In partnership with Department of Education, and thanks to the Governor's Office Youth Education Grant, this is something that we can look forward to in the upcoming school year. This is an anonymous app that will be implemented in the middle and high school, where students, and as you know, our kids know what's going on before we do, of any possible, they know if somebody is thinking of committing suicide, bullying, gang fights, or any of those things that happen in the school system, but they do not want to be targeted or be called a tattletale, so they can use the app to anonymously report the app, and depending on their location, that app will respond to the administrators of the schools and the proper first line responders. So very exciting. That's one thing that I'm very excited about for this coming school year. Mental health wellness checks for COVID positive persons in the community is going to be started, and that's going to be paid out of the SAPT supplemental and Focus on Life local funding, as well as the tobacco cessation for GBHWC consumers. We used to have tobacco cessation programs way back, but unfortunately, when you have the trainers retire, you need to build that program up again. And so we are training staff, multiple staff, instead of having that burden under one staff, and that will be ongoing for GBHWC consumers. So this page is a synopsis of all the services that Guam Behavioral Health provides to the community. Next slide, please. This is a snapshot of clients served. In FY21, we served 1,625 new admissions, or an average of 135 a month. It's not including the drug and alcohol clients that we serve at 849. Today, FY22, year-to-date, as of April numbers, we've already served 1,050 clients, with drug and alcohol year-to-date as of April at 552. You will see that it is an increase compared to last year. If the trends for this year's continue, there'll be an additional 22 clients in drug and alcohol that will be served. Next slide, please. Continuing the snapshots of clients served, those who are taking medication under pharmacy, you have since 2019, when we received and we employed our first full-time pharmacist at Guam Behavioral Health, there's the number of prescriptions filled. In 2021, we had 15,331. Year to date, we have 8,903. If the trend continues, we're looking at an increase of 206 a month compared to 2021. Next slide, please. Under Human Resources, we have a total of 292 employees as of yesterday. Of that, 170 are classified employees, 122 are unclassified employees. Of the unclassified employees, 25 are locally funded, 97 are federally grant funded, and of the 292, 64% or 188 employees are direct service, and 104 are indirect service. With regards to recruitment and retention, in 2019, the department applied and was granted a certified site recognition with HRSA, the National Health Service Corps. And this allowed, being recognized as a site, allowed for loan repayment for our individuals who work at Guam Behavioral Health. And today I'm happy to report that 4 counselors are taking full advantage and trying to retire their student loan debt because of this recognition. Of course, we recruit and retain. We're looking at recruiting in telehealth services and locum tenens. These are the areas or the or the platforms in which we get a lot of our potential professional services interest. Something that is new, and you'll see this in the federal grant reporting in the next couple of slides, is the State Loan Repayment Program, or commonly known as SLRP. The application was just submitted a week and a half ago. We're looking and applied for over $2 million, or $547,000 for the next 4 years. This will allow $25,000 per applicant debt reduction. This amount will provide 20 healthcare professionals, and not just Guam Behavioral Health, but this application, we applied as the administrators. So of the 20 healthcare professional slots, this also applies to GMH and GMH and Public Health. So all 3 health agencies will be able, their staff will be able to take advantage of this debt reduction if the loan is approved, or if the application is approved. Next slide, please. FY22 current hiring status. Out of the 47 vacancies that we requested to be funded in FY22, 16 have been filled, 23 are in the DOA recruitment process, 6 are professional staff, meaning psychiatric nurse practitioners, 3 psychologists, 1 psychologist, and 1 MD or physician, and 2 have yet to be announced. I am happy to report, because Guam Behavioral Health is a health agency that gets funding or reimbursed by CMS, we are required to be 100% vaccinated, unlike other agencies. We are at 99% because of the 3 medical exemptions of the employees. And something that we included in the slide, because this is something that is mandated for all of us, is the procurement and ethics module, ethics training. Currently, in the procurement module, 8 appropriate employees have satisfied that obligation. And with regards to the ethics training, only 3, myself, the deputy, and Debbie here. I'm sorry, not Debbie. The 2 of us and the training officers. A training officer have been trained in ethics. However, the plan is that current employees receive ethics training within the first 12 months. We are unfortunately subject to the ethics training office calendar, and we are negotiating number of seats per monthly training. But that's also something that all the departments are negotiating. So let's see how many seats I'll be able to get every month. However, any new onboarding, a new hire, is required and is part of the onboarding training that is performed by the training officer, and they need to get that ethics training within the first 6 months of their employment. I just wrote down that the ethics cost for 292 employees is at $23,000 plus, and it is budgeted in FY23 ask, as well as the grants. So employees who are grant funded, we have written it into the grant budget. Next slide, please. Our budget summary and our ask. We are funded primarily by the Healthy Future Fund. We are asking a total of $24 million. Operational budget request is at $18 million. Under miscellaneous appropriation is $3 million for drug and alcohol rehabilitation service contracts with our NGOs, and $2.1 million for 3.7 detox program, which is also under miscellaneous appropriation. The general fund request is at $366,000. Of that, $285,000 is Youth Mental Health First Aid Program, and $81,000 for Focus on Life Suicide Program. The local funding total is at $24.371 million. Our federal grants currently is at 27 million, and we anticipate that same number for FY23 for a total of approximately 51 million. Next slide, please. Slides 9 and 10 at your leisure, senators, are all the grants that Guam Behavioral Health has applied for, submitted, and awarded. On slide 10, these are the pending grants that we currently submitted and waiting to hear from. The SLRP, or the State Loan Repayment Plan, is indicated there, as well as another grant to the Reduce Opioid Use Disorder and the Prescription Addiction, Opioid Addiction, another grant. So there are 2 drug and alcohol grants that we're waiting to hear from, as well as the SLRP program grant. So that's slide 9 and 10. Slide 11, next slide please, is the American Rescue Plan. We received 5 million. So far our expenditure is at 731,000. Of that 5 million, 2 million is personnel and operations at 2.9 million. The items to include, and a lot of replacement of original plumbing of our 1993 building, as well as the much needed replacement of our current elevator. But rest assured, the director of DPW has signed off on the safety, so it is still safe, but it is time to replace because we're servicing it more than normal. There's a list of items that is included in our American Rescue Plan. Slide 12, please. Drug and alcohol services, because I know this is very dear to a lot of your hearts. We wanted to highlight this. Our 3.7 detox unit started in August of 21. Thus, so far, we have served 15 clients. 18 of 23 personnel on 3.7 has been filled, with 5 pending. For the residential treatment program, you know this as our nonprofit organization contracts. You know that last year, because of OASIS's business decision as an organization to not follow the mandate, we terminated their contract. Guam Behavioral Health immediately absorbed the contract, and without any interruption, we continue to serve the women in the residential treatment house. Salvation Army currently has the men residential treatment contract at 15 beds, and Sanctuary, of course, has the youth at 10 beds. We anticipate the expansion of 30 more beds in January of 23, and that's after the renovation of the cottage home that I mentioned earlier. I did mention there was some concern about the ending of the OASIS contract, but rest assured, it really went without a hiccup. We had a home that was newly renovated for isolation that wasn't being used at the time. So we moved the ladies into the home at that time until we can settle our contract with the renter. And then we moved them back, and that was in a span of a week. So they're in a home, the same home, so there's very little interruption, even in their environment. New service contracts, just so everyone is aware, is up for bid. And so it's starting this summer. We're going to put that out, those contracts out to bid, and we look forward to getting new contracts in place in October. Next slide, please. I wanted to also highlight the Criminal Justice Program, which is commonly known as the DOC program. As you know, through executive order and through collaboration with then Department of Corrections Executive Director Joe Carbolito and myself, in concert with the front office, we all determined that the mental health and substance use programming should be under the management of Guam Behavioral Health, because DOC, that's not their primary mission. Their primary mission, of course, is safety of the clients that they're or the inmates. So we took over in July of last year. The number of clients served since August or to the present is 441. Services provided for mental health is the screening of all magistrated individuals down at the Hakatnya Detention Facility as well as Post 8, intakes conducted for those determined to be in need of mental health services, and of course, our crisis stabilization unit, which is primarily for the population of DOC. And this allows Post 8, which is commonly known as Post 8, the stabilization unit at DOC, is similar to our community stabilization unit in Tamuning, but this allows, the annex allows the non-mixing of those DOC population and the community, which was a great concern. Services provided for substance abuse, the DOC intake guards conduct screening to determine risk level for substance abuse, and that list of individuals will determine if they qualify for RSAT. Currently, we're working with the Department of Corrections Management to identify rooms or space for group daily substance use groups and therapy. That is a concern of ours and a very big concern of DOC, and we really look forward to their new facility, because that new facility has a dedicated classrooms for groups and therapy to happen on a daily basis. And last but not least, I want to talk about our crisis hotline, which has been the lifeline, I believe, to the people of Guam, especially during this pandemic. You will see before you, pre-COVID and every year after that, the crisis hotline data. Prior to COVID, we received 25 calls a month, not even a call a day. Today, as of today, we have 1,470 calls, an average of 400, close to 500 calls a month. What does this mean? We're really busy, but it also means that the crisis hotline has become a permanent number in people's homes, and they're calling us. Despite COVID reduction, they're still using the crisis hotline to access services and to get appointments. The National Suicide Prevention Lifeline, we received that designation in January of last year when we applied for it. Why is that so important? Because the 1-800 number in the past was being, those calling the 1-800 number from a 671 prefix was being answered by an off-island service provider and was not rounded back to the local jurisdiction for follow-up services. So, what happened to those callers who called the 1-800 number? We don't know. We pray that they eventually walked into a local facility and got help. So that's why we knew it was important to apply to be a Lifeline partner. When we did that and we received the designation in January, we now get the calls routed to Guam. And we are servicing people, whether you call the 647 crisis hotline number or the 1-800 Lifeline number, a Guam Behavioral Health professional is answering the phone. and is helping you get the services you need. And so we're very excited because after we've learned to dial 7 numbers and recently 10 numbers, come July, we're only going to need to know 3 numbers. 988. 988 is going to be nationally implemented in July of 16 of this year. And there will be only 2 very important numbers that should be in every refrigerator and every person's memory. 911 for medical and safety, and 988 for suicide and mental health services. And I close with that, and I remind the senators, good senators, and the people of Guam that Guam Behavioral Health, through the crisis hotline, is here to serve you. But we're also a 24-hour operation, and we have never closed, not even during the height of the pandemic. So I want to take this opportunity to thank most of my staff, who I'm sure is watching this, for their dedication and their hard work. And thank you for all the frontliners and the partnership that the people of Guam has come together and helped Guam Behavioral Health to continue to serve the people of Guam. So a big shout out to my employees and to all the frontliners and to all of you who has helped in one way or another. I started in the beginning that May is Mental Health Month. And so I invite all of you to one, if not all, our mental health activities. This Thursday, the Governor's Proclamation is at 8 a.m. virtual. And why go virtual at the time when we're removed masks? Because we always have more than 100 people show up and there's no way they can fit. So we're virtual still at 8 a.m. on this Thursday for the Governor's Proclamation signing. We invite the people of Guam to Friday's Children's Jamboree, which highlights the Children's Mental Health Awareness Week that we're in. Kind of reason why I'm wearing green, because green is the Children's Mental Health Month color. And that is this Friday at Epal Beach, starting at 4 o'clock. And we invite families and children to come because it's kind of like a carnival atmosphere that you can still receive information of what services are out there for your children, not just from GBHWC, but from partner agencies of the government of Guam. And last but not least, we have a 5K, 10K that you don't have to do it in one day or one morning. You have the whole month of May to do it, and so we invite everyone. There are 8 activities. If you log in to Guam Behavioral Health, Facebook, all our social media platforms, Instagram, you'll be able to get all the information. But we did partner this year with Guam Time, so if you go to www.guamtime.net, all the information for Guam Behavioral Health's Mental Health Month activities are there. And with that, I thank you, Mr. Chairman, and all the colleagues, all your colleagues here, the good senators who are here to support and hear our bill, our budget requests. Thank you very much.
Thank you, Ms. Arreola. I'd like to also recognize my colleagues that have joined us. We have the Oversight Chair, Speaker Teresa Lai, we have Senator Talina Nelson, Senator Sabina Perez, Senator Tony Ada, and Senator Jim Whelan. And I'll ask the Speaker, the Oversight Chair, if you have any questions for the panel. And I'd ask the panel, when you answer the first time, please identify who you are. After that, you won't have to. Okay, just at least the first time. And for you, Ms. Arreola, we know who you are. It's the other 2 staff that you have. Thank you.
Thank you very much, Mr. Chair, and thank you, Director Arreola, for your presentation, and to all of you who I know worked very hard to prepare this and to give us a very clear picture of everything that's ongoing and has been ongoing during the pandemic. Thank you so much, and thank you. I echo your thanks to all of your staff for their work as frontliners. So I'm going to start overall. Your budget request, even as reflected on the OFB spreadsheet, was only 15.9 million versus what you've said today, your budget request is 23 million, or 24 million. And I know this now echoes the governor's budget request, but I want to ask you, before you made these changes today, how were you planning to fund these detox and rehabilitation services, 3 million, the inpatient detox program, 2 million, the New Beginnings, the youth mental health first aid program, and the youth suicide program? Were these already incorporated in your $18 million estimate?
Yes, ma'am.
Okay, so you can still take care of all of these with the 18.9?
It's under miscellaneous appropriation, the drug and alcohol, as well as the 3.7 detox.
No, I mean...
So it's not included in the 18, I'm sorry.
Oh, it's okay, so it's not.
Right.
It was not?
It was not included.
How were you planning to fund that according to your request, which was 18?
Well, we requested it through the miscellaneous appropriation. That's where these things are
Okay.
funded in the past as well.
All right, so if you only got 18.9, would you be able to accommodate those programs?
Well, something's going to have to be cut. And I would have to go back to the drawing board to see what would be cut. But with regards to the NGOs contracts, they're normally in the past, and ever since I remember, have always been a separate appropriation from the ask.
Okay. What about the crisis stabilization unit, the annex at DOC?
Yes.
Is this the new? That's
Yes.
new? And that's an inpatient, separate unit is what's new
Yes.
about it, right?
We're talking about Department of Corrections?
Correct.
Yes, ma'am.
Okay, but what about the staff? Are we, like, for example, Dr. Pat Timinglow was there before. Is that unit kind of taken over by Guam Behavioral Health, or?
We have 22
something?
staff currently in that unit. We had to, before Guam Behavioral Health came in, they only had four employees. And that clearly wasn't enough. And we're actually standing up, and based on law, we have to stand up a mental health program that we do in the community for those in the prison system. And that's, I guess, their right. So we're mirroring what's outside for the community inside.
Okay, so when did you do that? Is that established yet, or you're working on it, and that's for FY23?
Oh, we have, as of July of 23, we have currently,
July 22?
or 21.
21.
Yeah. Currently, right now, and that's why a lot of things, a lot of the DOC personnel is under recruitment right now, is we had to share.
They're transferring over. So they were DOC employees, now transferring.
Well, 4 of them, but we
Okay.
had to stand up a more solid programming.
Okay.
So we did absorb 4 employees from DOC's mental health, I think they called it their forensic unit staffing. So they're no longer Department of Correction employees, they are now Guam Behavioral Health.
Okay, and then the substance abuse screening that you were doing for DOC, has this type of screening for sexual assault cases been requested of your department by the court, or by DOC, or by GPD, or by the AG's office? A screening for risk of repeat sexual assault?
Yeah. You mean for sexual assault?
Yes.
No.
Only for
Only
substance.
for substance abuse.
Okay. All right, and then
We also don't do, just in line of that questioning, we also don't do fitness, work for fitness evaluations
Okay.
for
And-
parolees.
All right. Is your pharmacy a source of revenue?
Yes, sure is.
And so is that reflected in your revenue?
It's not reflected at all, but we are, again, CMS reimbursed. And so, as you know, in the past presentations, we are aggressively billing CMS, and most of that billing revenue comes from pharmacy. We've just recently signed with all of the service providers, the third-party service providers, the 3 main insurance companies. We finally got in line of what they're going to pay for and what they're not going to pay for. And so I just recently signed, I think 2 of them, 2 of their contracts. So yes, pharmacy is billable, and we do get that,
All right. And so,
or to capture that.
yeah, how would we know, how much is that, or where, that's not reflected in these special funds? So you have a revolving fund that you're using?
Well, we deposit into a fund that was created by the legislature.
Okay. Is there a balance?
I can tell you.
Okay. And does your budget reflect the amounts received from the Attorney General's opioid funds?
That is a grant, and so the budget does not include that, but it is recorded in the grant list, and those 2 positions that we received from the opioid settlement go straight to DOC. Those
Okay,
are
but that's not a
DOC.
federal grant, that's a local grant,
Well, we consider it a grant,
right?
so it's listed in the grant.
Okay. And so those 2 positions would be listed in your staffing pattern as well?
Yes.
All right. And do you list federal employees in your, federally funded employees in your staffing pattern?
Federally? No.
You do not?
No.
Yeah, I've noticed that the agencies don't. Okay, what about, did you have the answer on that other
Okay.
fund?
Regarding the
Pharmacy?
pharmacy. As of today, pharmaceutical medication, we have gotten reimbursed at $347,000.
And how do you use that money?
We haven't, because we would need to come to you to ask for it.
Okay. What about, all right, just talk to us about the shortage of personnel and how are we going
Are we
to
handling it?
fill those, particularly, right, I know you talked about your recruitment efforts for one
Professional
doctor, one,
services, I
yeah,
think
the psychiatrist, psychologist.
We do our best. I believe we talked about that. We have interviewed 12 psychiatrists. In the last year, 4 of them continue to express interest in Guam. 1 application is already being reviewed by the Guam Board of Medical Examiners, the licensing board. 1 is retired from the military, will be retiring in the military in August, and currently living in Korea. 1 just recently gave birth, and so we need to reconnect with her at the end of the year. She's asked us she's interested, but give her time to be a mother. And 1 is currently living in Qatar, who's also interested in moving to Guam. So we need to circle back with them, but these currently are the 4 who are of great interest. I can tell you it's not a nation shortage. It is a worldwide shortage of professionals in the mental health field. And so, I hate to say it, but it's almost like we're pulling from other jurisdictions to get them here. So, recruitment is it's not an easy task, but we are in partnership with GMH and their locum tenens, and every hit and interest we get, we follow up. We alone ask the very, very limited handful of psychiatrists in one hand who are licensed to, I'm just like, well, give me somebody. Don't you have a colleague or somebody in school, where they went to school? They're all at the age of considering retiring. And unfortunately, COVID has taken a great toll. So if they still have the energy prior to COVID, they're really, really considering retiring now. And so how did the department shift? We never in the past ever hired MDs, physicians. but we did, and we do. We have 2 doctors on staff. Why is that really important? Because absent a psychiatrist, the next best professional staff is an MD who has had at least some training and internship in psychiatry. Not everyone, the people of Guam, especially the low-level concerns, anxiety, depression, most of them are handled by your family physician anyway. And so we have hired 2 medical doctors, something you have never seen before in Guam Behavioral Health, because we've left the doctors for the hospital and public health, but we are in need of them. We do have, and thankfully, a psychiatric nurse practitioner with prescribing authority, very specific to the substance abuse 3.7 detox unit. There's specific meds, specifically Suboxone, that needs a special certification to administer, and we have her on board. I'm thankful that she has gone from part-time to full-time today. That's our nurse practitioner with prescribing authority.
Okay,
So-
because you said that you've got 23 vacancies in the recruitment process. 6 of these are professional staff that you still need to fill, or in the recruitment process, and 2 yet to be announced. So the 6 that are in recruitment process include, you said, a doctor.
Right. 1 psychiatric nurse
psychiatric
practitioner,
nurse, yes.
3 psychiatrists,
Okay.
1 psychologist, and 1 more physician.
Yeah, so I just want to be very clear in this budget hearing. So there's not a budget shortfall that is preventing you from hiring
No.
any of those. Those are all funded vacancies you're trying to fill.
Absolutely.
Okay,
It's not a money issue. It's a recruitment availability issue.
all right. And moving forward to FY23, do you need more than these because you still have vacancies unfilled? Are you expanding any of this professional staff?
No, if
Can fill
we're
those.
lucky enough to get all these
Okay.
on board, we'll be able to handle it. We're handling it now, senators. We're just being creative and handling it.
Okay, so you need the psych nurse practitioner to prescribe these drugs in addition to the 2 MDs that you have?
Right, because there are certain drugs that only require a specific license, and unless the medical doctors actually go back into an online course for about a week or so, well, I think it's a little bit more than that, they'll be able to get it, but SAMHSA will only allow so many, a gradual increase in the number of patients they serve. So I think they allow you when you first get licensed, like 30, right? 30, right? And now it can grow up to 100
Okay.
patients.
All right, so have you been recruiting them through normal process, or do you have to recruit them above step, or how have you been successful?
Right, so all of our professional services are contractual. And that because to keep up with the current marketing trends, and because I mentioned that they are very, very sought out, to be competitive, we couldn't pick them up in a classified position because we really won't get anyone because
Okay.
it's beyond
So even those are going through DOA though?
AG's office contractual. AG's office, governors has to sign.
But not DOA, right? Are
Well,
you doing
DOA
your
has
own
to
procurement?
DOA has
That's
to
a procurement,
sign
not a
it.
human
DOA
resources
signs those
issue,
con-
right?
DOA signs those contracts as well. They're part of the signature page of the contracts.
But who's doing the,
We do. We
Okay.
do. We initiate the contract.
you're doing the procurement for professional services?
Services, yes.
And DOA's doing the recruitment process
For
for the
classified.
vacancies, the merit vacancies?
Yes, the classified merit
Yes. Okay.
other employees.
And so the 23 in recruitment process, those are merit employees, not including contractual?
Yes.
Okay, all right, thank you. Thank you very much, Mr. Madam Chair.
Thank you very much,
Thank you.
Speaker Terlahi. We'll begin from the far left, Senator Taitigui.
Sujus Masi, and good afternoon, everyone. Thank you so much for being here, ladies, and all the hard work that you're doing over at Guam Behavioral Wellness. Greatly appreciate it. And please extend our Adunkulu Sujus Masi to your staff. You know, please let
They're
them know. Good, please. Off day, everyone. Now, I want to go to, with regards to federal, or not federal funds, but special funds coming from the Healthy Future Funds. In FY21, the end of September, the CRER was reporting that there was a $3 million shortfall in special funds. I'm sorry, in Healthy Futures Funds. The Healthy Future Fund?
There's a short.
Okay, there was a shortfall of $3 million. Did Guam Behavioral Wellness get their full allotment during FY21?
Yes.
Okay. Nothing was covered from the governor's office? No money was transferred from the governor's office to Guam Behavioral Wellness?
No. I'm sorry, one more time.
Okay.
What was your last question?
The Healthy Futures Fund.
Yes.
Okay, it came in at a negative at the end of FY21. Okay, fiscal year
I
FY20.
received,
But did you receive, that's why I was asking, because it did come in $3 million short, and was wondering if you received your full allotment from the Healthy Futures Fund.
for FY21, yes.
Okay. It's still tracking, you know, it's still tracking short. We're still showing a shortfall, but you're receiving your allotments. Okay.
Yeah, no problems.
Okay. It mentions in the ARP funding that you receive $5 million. And based on the report that's given to this body every month on the expenditures of it, the encumbered and how much has been in expenses, it's coming a little bit different from what you have here on your report. It does show that there was $5 million appropriated to, appropriated to you, and then it says expenditures $731,542. And then you have personnel at $2 million, and then you have operations at $2.9 million. Can you kind of explain, I mean, from expenditures, is that what you've currently spent so far, and that your intention is to use $2 million, or the remaining for personnel and operations? Is that how I'm reading this? Because, you know, it totals up to 573 if you add the 3 up, but just trying to figure out how
I'm
you
sorry.
did this.
The expenditure is, the personnel and operation line adds up to $5 million. But the expenditure is within the operational side. So it's not in addition. I'm sorry, is it the way I wrote it?
Yeah, it kind of looks...
It doesn't add down, because if you add down, then
Okay.
it's too much.
So in other words, for operation, if you add the personnel and operations together, it does total that amount. But are you saying that so far you've only spent in expenditures $731,000?
That's correct,
Okay, so you still have this money remaining,
absolutely.
and you plan on using $2 million of that for personnel. Can you
Correct.
kind of explain exactly who will be receiving this?
Do you want to know the positions of the
Yes,
ERP?
well, yeah.
Okay, there are 18 positions.
Is this for hazard pay? Is this for overtime? Is
No.
this for anything, or is this
This
just
is
regular
strictly
salary?
hiring salaries.
Has any of this money intended to pay any new hires?
Yes. Yes, 18 of them.
So this funding is to fund 18 new hires.
ARP is funding 18 new positions.
So if that's the case, then how are you going to sustain them?
I'm going to request it in the FY24 budget, because the ARP doesn't expire until '24.
So right now, you're hiring these individuals and hoping that the legislature will fork out their salaries in FY24. That's what you're saying? And that's what I heard.
Yeah. I mean,
Yeah.
every year we ask for future employees. I mean,
Right.
we're hoping that you'll fund even current classified. So that we would be in the same line of thinking. Everyone who is funded today, we would be asking again, unless they leave us, to be funded next year. It would be the same process, I guess.
That's not a very good sustainable practice, you know, to hire individuals right now using this funding and then come
But
to the
Senator,
legislature and later on.
It would be part
and-
of our request.
Yeah.
Just like it would be our request for classified employees to be funded.
So are
the
these
following.
any of these individuals classified, or are they unclassified of the 18?
It's competitive limited term. Do you want to speak to that?
Carissa Pangilinan, Deputy Director. So competitive limited term, meaning that it does go through the merit process. They do have to be profiled and rated qualified, but they are only hired for the term of the fund. And it is stated on the GG1 as such, and in the announcement.
Okay,
But the
so
intention is
okay,
to
almost
ask
like
for
a
it.
grant, like, you know, when you're hiring an individual, it's
Sort of,
like how
yes.
the grant works. So these individuals, these 18 individuals are employed on the assumption that once the money runs out, then that's it for them.
Correct.
Unless this body provides
Unless
a
we
salary.
ask for it
Unless
and
we
this
ask.
body in FY24 approves it.
Was any of this funding used for any salary increases at all?
No.
Okay. And the operations on 2.9, you explained further down on items included. Is that 2.9, that's everything just clearly in operations?
Yes.
Okay. How many residential treatment patients are currently serviced off-island?
6.
And what is the cost to the Guam Behavioral Wellness?
I don't have that figure. It is administered by the Department of Administration, but I can get that figure for you. We process the payments, we certify the legitimacy of the payments, that they are a client of ours, and we go through the billing. But Department of Administration, through the, it's not Guam Behavioral Health's budget that pays for it. It's through the residential treatment fund that is funded by this body separately.
I'm sorry, say that is what?
The residential treatment fund
Yeah.
that is funded by the legislature every year, that pays for the off-island residents
And
of
you-
Guam Behavioral Health.
Okay, and you don't have the fund, that amount with you right now?
It's given to DOA. DOA manages that fund. I don't.
But yet you pay for it,
Yes, and we can get you that.
and through the, a grant?
No, we don't pay for it. We
Okay.
process the payment for it to be paid. DOA manages the fund, so
Right, through
DOA pays them
Through that fund?
through that residential
Joe
treatment
Richard.
fund. Correct.
And that comes out of what, how is that funded, that residential treatment fund funded?
By you folks,
Okay.
by
It's not a special fund or anything, so?
no,
Okay.
by you folks. Appropriation, I guess general fund, I'm not sure.
Okay.
Yeah, I'm not
Well,
quite sure the
it's
breakdown of
coming.
how that fund is.
Okay, I'll look into that. There are about 9, several grants that may end in the 31st and September 29th, I think. Are any of these grants programs with the government of Guam? Well, any of them planning on, well, not planning, but expiring shortly, and any grants that are really doing such a great, you know, doing a good job at your agency, how are you going to sustain that, especially if the grant runs
Well,
out? So you have anything
we're
coming up soon,
Yeah.
like in the next September, August, you know, before we pass this budget, that is in dire need of funding in a program under your agency?
Well, any service that we do is, and we're we're pretty blessed because mental health has gotten a lot of attention in the federal appropriations. So there's quite a bit of grants coming down, worded differently, but allowed to do continuous similar services. So we're constantly applying, and that's why you see the major number of applications of federal grants. And when sought or when it fits, we work with the grant funder, and we continue similar or scale down services. But that's how we do it. We look at future grants. SAMHSA has had so many grants, especially because of COVID, and so we're lucky that there's a lot of funding that are flexible enough when we work with the grant funder to continue good programs like opioid reduction. You'll see a lot of opioid if you look at the grants. There's several grants that address opioid and addiction. And so in working with the federal government, they have just been so, our grantors have been so flexible, and we have a saying, you just need to ask, because 99% they're going to say, yes, you can use the funding. So we don't just, anyway, so there's a lot of grants that are coming down from SAMHSA, probably out of COVID, one of the most major grant funders that continuously have a lot of grants availability and federal funding availability because of COVID and the aftermath of COVID.
Have you requested for additional funding from the governor's ARP funding on top of
Beyond
the
$5 million?
Yeah.
Not necessarily, no.
Not necessary.
No.
Okay.
The answer is no, because it's not necessary right now.
Okay, well, thank you
Right
so
now,
much.
at least.
Got to put that part in real quick. Well, thank you so much again, ladies, for all your hard work. Thank you.
Thank you.
Thank you, Madam Chair.
Thank you, Senator Titlegy. Senator Brown?
Thank you very much, Madam Chair. I just wanted to follow up also with the employee count that you had here, and I'm sure you have a variety of services that they're providing, but you know, for a government agency, you have a high number of unclassified. Could you just give me a profile? You list here that you have 122 unclassified employees and 170 classified employees.
Yes.
Can you give me a profile?
Oh, sure.
You probably have the highest number of unclassified employees.
Right. And now we anticipated that question, Senator Brown. The reason why it's so high is because we have so many federal grants. So when we hire grant people, they're considered federally funded. So between grant, contractual, limited term, those are all unclassified at 122.
Yes, can you give me a profile of the kind of work that they perform? Would it be on the fact that I understand they're federally funded, but what specific kind of work, or do you have different categories of what type of work?
There's different grants, and so there's counseling grants that require a counselor. So there's counselors, social workers, crisis hotline, mobile crisis. All our crisis hotline folks are on federal grant funding, so they all are unclassified.
Is this a normally higher number versus a regular year? Is obviously some of this may be pandemic related, because I see also in your listing you provided a breakdown in terms of the number of service calls that are made into and services that you're providing has increased substantially as a result of the pandemic. Are the increased numbers, is this like on average, is this a normal number of unclassified, or is it primarily because of the pandemic, and then, you know,
yes.
average year you maybe have 50, I don't know. What would that number be on average?
Well, it's normally up there because as aggressive we get in the federal grant side, we hire, and so I can only say during my time that we've been very aggressive in seeking grants, and so I would say that it's been pretty high, at least in the last 3.5 years.
And with regards to, obviously, you know, there's a lot of focus with the concern of the growing drug problem on the island in this past year. How many more, or, you know, what are those numbers in terms of clients you've assisted? And what's the normal process for someone? Because we don't have, what you would look at as traditional drug treatment. I mean, normally people hear, oh, they go off island to get
Right.
extended treatment that's needed, but can you just give us an idea of what's provided, what you're able to provide, and what the time frame is? And of course, everyone's an individual process, individual circumstance.
Right.
But if you can give us some idea,
Sure.
and if that's increased percentage-wise, have you seen more in the last couple of years, or
Yes.
what the case may be with
Very
regards to
much
that? I
so.
think it'd be good to know that information.
There has been a very great increase in the drug and alcohol services. If you look at the snapshot that we presented, year to date is already at 552. If that trend continues, we're looking at, what is the total we said? 175, 92 a month, year to date is drug and alcohol. So there versus 70 a month last year. So there has been an increase, and you mentioned, like, what's the process? So if an individual has a desire to get help, you know, they can call the crisis hotline, and we can navigate an appointment through there, or they can come to the front door at Guam Behavioral Health and say, I need help, and they will be processed through an intake process. Once they get processed through an intake process, they will be determined through a clinical meeting which programs they will be, and obviously through the intake, they're going to probably hear it's more of a drug-related issue. So then they'll be assigned to DNA, Drug and Alcohol New Beginnings. At that time, in a week's time, I would say 3 to 4 days, by the time the clinical team meets and assigns them to the program, DNA will come up and call them for an assessment. At that time, it's being assessed on what level of care in the drug and alcohol services they need. Some of them may be determined based on the assessment that it's just education. Some with severe addiction will have higher services needed. Some of those services are residential treatment. That's the NGOs that you folks fund. So those programs are 6 months, at least 6 months. After that, they're out for outpatient services. So we have outpatient services, residential. In between all that, if somebody is in active withdrawals, that's where the 3.7 comes in. You must be actively withdrawing to be a candidate for 3.7. So a lot of our major alcoholism is, they have severe withdrawals because alcohol stays in your system, and the withdrawal symptoms are very severe. The shakes, the sweats, unfortunately throwing up. I mean, you're just literally detoxing from that poison that's in your body. And so, again, there's different levels after the assessment, and they're assigned. But really, our turnaround is anywhere between 3 and 4 days before you get an appointment. And after that, we try to provide the client who comes to our front door whatever support they need, and that includes counseling, individual counseling. Social workers are assigned, lead providers are assigned to them to navigate what else is going on in their lives that's causing them to return to the drug or the addiction, because maybe they have problems with housing, or maybe they're having problems with jobs. And so our social worker, our lead providers, helps them navigate the other services of the Government of Guam, because once those things are stable, then they have a better rate of sticking to their recovery program. So.
And just one other question. I mean, in terms of the return rate, the recidivism, what is your numbers with regards to clients you probably have previously assisted and may, for whatever reason, end back at your doorstep? How common is that?
Very, very common. It is not unusual to see those in addiction come to our front door at least 3-4 times before it really sticks, if you will, for lack of better word. But nevertheless, it's okay. I mean, the important thing is they're coming and getting help. And they're trying their best, and if they slip and they come back again, that's okay. Because the key is that they're coming back and trying to get help. And after several attempts, it will set in, and many of you people you know, our family members and friends, have been sober and have been in the road of recovery.
And then,
But difficult, a difficult road.
And then also, I assume you guys are able to track them just for aftercare to help?
Yes.
If they need any follow-up or counseling or
Absolutely.
whatever the case may be? You're still able to
Absolutely. So
provide
they don't,
aftercare?
even if they finish, like, for example, a residential treatment program for 6 months, it's not the end. They come back, they're still a client of ours for follow-up and outpatient services.
Well, I appreciate your input with regards to that, and I just think also for public information for those that might not be aware, at least so
Very
they know
emotional.
what the process will be out there if they need help to call your agency. I appreciate it. Thank you for
Thank
giving me
you.
that information. Thank you.
Thank you,
Mr.
Senator.
Chair.
Thank you, Senator Brown. Senator Nelson, do you have any questions for the panel?
Thank you, Mr. Chair. Good afternoon.
Hi.
In recognition of Mental Health Awareness, thank you so much. Mental Health Awareness Month, thank you so much for the work that you've done. And
You're wearing green, so
yes,
it's all
I'm
good.
wearing green. Yes. So the community in the island of Guam thanks you. We are going through a difficult time. You have stepped up, you have expanded your services, you have created inpatient care, you have expanded your inpatient care, you're looking to grow the services for the people that have been desperately needed for over 10 years. So I'd like to applaud your team, Director Ariola, and yourself for your leadership and working really hard to really get behavioral health where it needs to be to service the island of Guam. So thank you very much.
Thank you.
This amazing work that you've done over the past 4 years and your team, we're really grateful for it. In response, I see in your federal grants, you have your COVID-19 emergency response for suicide prevention. Can you just tell us a little bit about that program? You have $780,000 set aside for that. I'm thinking you're using that now. Can you tell us a little bit about this program and if we're looking to sustain this, because it's COVID-19 money, if we're looking to sustain this in FY23?
I'm sorry, Senator, what's
It is the FY 2022 federal grants.
slide 10? Are you looking?
Yes, like
Okay.
that. Thank you.
Yeah, I'll have my very capable deputy
Okay,
speak about that.
thank you.
Hi, yeah, so this ERSP, we call it ERSP, it serves 25 and older victims of sexual assault and experiencing suicide ideations. And so the $780,000, we did get a 1-year extension on that, but that unfortunately will end on May 31st, so we're looking at the end of this month. However, our counselors that are on that and our social workers and our data person, we're moving them on to other federal grants, so that service will continue under our adult mental health outpatient services. So the clients that are currently being served in that program are not being forced to close. They will transition smoothly into the adult services.
Thank you. And are you looking to sustain this program for 5 years, 10 years moving forward? Is there a plan in place to sustain it?
Well, we do have a Focus on Life federal grant. So that's another grant that's good for 5 years, and that is also suicide prevention. So we're very blessed to have several grants that address suicide prevention.
Okay. I hope that as you evolve your blueprints for the upcoming years, that we see the continued services that we were able to provide for the federal grants, especially from COVID money. If you can sustain those, I will advocate very, very much to sustain that and work very hard if I'm still in office and to help. Okay. And then the next one is, God bless you, the criminal justice program.
Bless you.
the Criminal Justice Program for Department of Corrections. This is slide 13. And I want to commend your collaboration with Department of Corrections, really streamlining the services and ensuring that we're able to service the inmates within Department of Corrections. It also alleviates the load of the caseworkers there. So thank you very much for this multifaceted approach. It's very comprehensive, and I appreciate the move to eliminating redundant services. So in this area, the criminal justice program, we had DOC here earlier this morning, and we discussed a little bit about the collaboration they have with behavioral health, and they stated that there is an MOU signed, and they do have personnel from behavioral health going to DOC every day. Is this going to continue for the upcoming years?
We're actually there.
Yes.
We live there. Part of our team, we have staff
Right.
that is permanently there.
Oh, permanently there,
Yes.
okay. And this is about 20 personnel?
22
22, very good, okay.
at the moment.
And how are they funded?
It's a mixed funding. Give us a minute. Both local and federal dollars.
Okay, and what federal dollars are they utilizing, and how much? And can you also...
CMHC grant. There is a grant in your federal listing
Okay.
called CMHC. Community Mental Health Grant. Sets aside funding
Okay,
to support the mental health services in a correctional facility,
okay.
as well as DYA, by the way. My presence is at DYA,
That's right.
taking care of the kids.
Great, so it's both in DOC and DYA, very good, thank you. And then what is the cost of it?
I'm sorry.
What is the cost?
Well, our mental health grant is 1.5 million,
Okay.
and so the cost for the DOC employees,
Yes.
is that what? Okay. Okay. I can get that.
Okay,
Of-
sure.
Of the, can you write that down? Of the 22, I can give you what is the total cost of the 22 employees of DOC.
And we're going to sustain this because they're permanent employees, they're classified employees, correct?
Most of them.
Most of them, okay. All right, very good, thank you. You have this on slide 10. Sorry, we're jumping everywhere.
No
You have this slide that says Certified Community Behavioral Health Clinic Project Agustin.
Again,
Can you just speak
call.
about this type of services that are there? And is it being sustained
sure.
in the upcoming years, please?
Okay, so Certified Community Behavioral Health Clinic, or CCBHC as it's called, is actually another form sort of accreditation, if you will, that is the national trend now. And so what we're currently doing is we took a look at the current services we have, we compared it to what a certified community behavioral health clinic should look like, and what is Guam Behavioral Health missing in order to fulfill that certification. And some of those services were, as the director mentioned earlier, mobile crisis, right? And so that's where that's being funded out of. Our crisis hotline is being funded out of this as well. And then there's other pieces to that, right? The grant requirements that we have, for example, data collection and quality improvement and such. Because it is a national trend, we are currently applying. We are in the middle of filling out an application for what's called the CCBHC Expansion Grant. So we just started our second year of this $2 million that you see here. It's actually 3.6 million total. And it was a multi-year award. So when you see 2 million, we actually, whatever's left of the 2 million from year one and the 1.6 that's now is what we actually have to spend. So it's going to sustain this past 2 years. But we are also in the middle, we are aggressively pursuing that expansion grant that I mentioned, which will fund it for another 4 years. And that will sustain those services for at least that time. And then we'll come before this body again and ask for your assistance to sustain that if we
Or
need
there might
to.
be another grant funding, you know, we just have to keep looking for those funds that kind of can help supplement or continue the similar services. Clearly they're not exact grants that are duplicated, but similar services.
Okay, thank you. So I understand that the nonprofit organization that was assisting in the female rehabilitation program, now behavioral health is conducting that.
Yes.
And how many clients do you currently have, and what is the program called?
We have that.
Okay. And this is an inpatient?
Inpatient.
Okay.
No, there's a lot. There's availability, I believe it's full. It's 16 because there are 16 beds. It's full. The house is full right now.
Okay, and then what are we doing if someone needs immediate assistance and the beds are full? What are the options that you utilize to assist the client?
Well, there are 16 beds, but there's 2 beds that are for active detox. So those beds can be can be used as well. But then that just means that, which is okay because we have a detox unit. So the detoxing, we'll just have to move them from detox into the residential versus having them to properly detox at the residential. So because they all come in different times, and I don't have that list in front of me right now, but the likelihood, and it happens, that when somebody's ready to come in, there's people who are exiting the program. Because they don't all start, they all start and end at different times. So they're staggered in and out.
Okay. So there hasn't been an occasion where you were not able to support a client that needed the assistance
Not yet.
immediately?
Knock on wood.
Okay, very good, thank you. I appreciate that.
Oh, it's plastic.
I'm sorry, I'm trying to look for the cottage homes. When do we anticipate that to be fully functional,
So as I mentioned to
operational?
you, that's going to be a great help with regards to expansion. And the nice thing about Cottage Home, if you folks have not seen that cottage campus in Talafofo, there's several buildings. So if necessary, we can actually have a female building and a male building. And so that contract is right now under review at the Attorney General's office. And so we anticipate that that will go out to bid this month because it's been there for April. So I think they're just rounding off their review. And so when that is, when we put that out to bid, and then the process of opening the bids and awarding the bids, then I can see that the renovation can start almost immediately. And then we look at operationalizing and ribbon cutting in January, or hopefully before then. It just depends on how quickly the renovation can take place.
That's wonderful.
Yeah. And so that will be an
Very good.
additional 30 beds for residential.
All right, thank you so much. Yeah, it is much more peaceful at
Very
the cottage
therapeutic,
homes. Yeah.
very therapeutic environment
It
in
is, yeah.
Talafofo, very.
So I'm looking forward to that coming to fruition.
Yeah.
Great job. I did see one of your grants that expired already. Was there a way that you were supplementing that service in different appropriations? But I can't find it, but I did see that in one of the briefings that you had a grant expire this year.
Are you talking about Maga'hågan, the FEMA grant?
Let me see. What slide is that?
The federal grant slide?
Yes,
Are you on
okay. Yes, there was one expiring.
Where?
Oh, well, never mind. just to ensure that we have all of our federal grants, that we are able to continue the services in the upcoming years. And that's my concern, because the services you provide are very vital, and they have been assisting the community, and I appreciate all the work that you've done. Yeah, you guys program manage a bunch of grants.
I think you might be referencing expiration December 2022?
Yes, that one.
So that's a 3.7 detox unit. So let me explain that.
Okay, I understand that. Okay.
So when we entered, when we first got into Guam Behavioral Health, there were several Department of Interior grants going back to 2009 that was sitting there not spent. So what I did is I spoke to DOI and I said, I want all that, no matter what was written for it, I want all that reprogrammed for the detox unit. And that's what they did. So, because the rule of thumb for this administration is spend the federal dollars first, we spent all the DOI funding as of April. So we're tapping now local funding starting April 29th. I think that was the cutoff. So
that's what happened. Okay. Thank you very much.
So you can rest assured that all that money that was sitting there is now used up.
Well, great job well done, and thank you so much for the hard work that you've done in the past and actually creating tangible items for the people to see. And so this is a huge accomplishment for behavioral health, and you know, we'd like to honor the work that you do this week, so thank you very much for your service to our island.
Thank you, Senator. Appreciate it.
Thank you, Senator Nelson. And for the cottage home, I remember when I was in the police department, so for the folks here, I know what
very therapeutic, right?
Yes, I know what it looks like, and I know I expect it to look a lot better. And I'll make sure that when you're done, we'll extend the invitation so Senator Nelson can visit and see it. I know it's a great place up there.
Absolutely.
Senator Ada, do you have any questions for the panel? And then you'll be followed by Senator Paris.
Thank you, Mr. Chair. Thank you for the presentation of your budget request. I think probably the only questions I would have is on your plans for cottage homes, and you're absolutely right. You know, being the former director of DYA, cottage homes was just such a fabulous place to go visit every so often. But I think the more appropriate use for it with Guam Behavioral Health and Wellness would actually fit right in. So looking forward to that facility getting renovated and open. But for the staffing of those cottage homes, where would that personnel come from? Are they already in, or
that's part
are
of
they going to
our
be new hires?
ARP request breakdown.
So are you going to be hiring them now in anticipation for a ribbon cutting in January, or are you going to be holding off until the end of the year?
Well, I think what we need to do is I need to get the construction going first.
Yeah, that's
and then I think halfway in, when we see kind of like the better timeline, then we'll definitely start hiring before the renovation is completed.
Okay. So the only other concern, that everything else was, you know, the presentation was great. The services and treatments and everything that's going on up at Guam Behavioral Health. You know, my hat's off to you guys both, all of you at Guam Behavioral. It's just the ARP funding, and that's really just my main concern, because this funding is an anomaly, right? This is not going to come back again next year or the year after. And the personnel that we're looking to hire under this funding now, that is going to fall under the burden of the general fund. And we're not going to be sure what will be, you know, collected in revenues to ensure that we have a healthy general fund to fund these positions. So when I think it was last year, I believe I asked when ARP was coming out, if agencies were planning to use this funding to hire, and every agency said no, that's not the intention, is to hire using this ARP funding. And now we're going through the budget process this year, and every agency so far has mentioned that they are hiring with this funding. I think GCC was during their budget presentation, they said they did hire. However, it terminates when the employment of that individual terminates when the funding runs out. So there is no need for the general fund to carry that person on. So I hope that maybe something that you guys can anticipate or work within that money that you do have, and if it's going to be moving funds from operations up into personnel to take them out for the year or year and a half so that they don't have to be carried on to the general fund would be something to think about.
So, Senator Ada, Guam Behavioral Health doesn't really receive funding from the general fund other than a very little bit, but the Healthy Future Fund is our main funding source. And yes, ARP, because Cottage Home is a new established, starting to, we're going to begin that operationally in January. That's also one of the reasons why anticipating that the governor increased the $1 million in the miscellaneous NGOs, because she knew that that was coming online. And so it's definitely going to be packaged along with all the other residential treatment, and we're just going to have to wait and see whether we're going to identify it as female or male. And like I said, there's enough space down at Talafofo, as you know, and so many buildings, well, 3 buildings really. It could be a male, a female, and then the main office and group classrooms in the center. So we've thought of that. How is that going to be sustained? And so that's where the increase in miscellaneous in the $1 million that the governor has requested for miscellaneous appropriation.
Okay, because even with Healthy Future Funds, right, it's a special fund, and if it doesn't track and fall short, the general fund has to cover those shortages. So we just want to make sure that, with proper planning, I'm sure that you guys have done an excellent job in doing what you need to do to ensure that the services that you provide are continuous. So just with this now, just make sure that whoever or how many personnel you hire under ARP carries out just for the term or carries out until the exhaustion of that funds, and then go from there.
Absolutely.
Okay.
Thank you very much.
That's the only questions I have. Thank you.
you.
Thank you for everything you guys do.
Thank you, Senator.
Thank you, Senator. Senator Parrish, do you have any questions for the panel?
Thank you, Mr. Chair, and good afternoon, Director Arreola, and to the staff that's here and everybody who's helped with this presentation. I think I was pretty impressed with the presentation, all the success and progress that I've seen from the last time that you presented a budget. I think a lot of the questions were asked. There's just a couple things that I was looking over in the original budget submittal. And under the clinical services prevention and training, there's a workload output. And so I'm just wanted, if you can talk about one of the items is implementation of evidence-based substance use screening tool in GDOE middle and high schools. And so in 2021, the level of accomplishment was rated at 0% in-person activities. Of course, that was during the pandemic. And then in 2022 was 50%, and then for the projected levels, 100%. If you can explain, is it all because of the pandemic, the reason why the change? Or are there other initiatives that you have planned?
Well, because the schools were out, we couldn't do much in the schools, right? So, but training is going to continue, like mental health first aid training that this body has funded in the past and is required for all school officials. That will continue. And actually, the person that should answer that is our master trainer here, my deputy. So she can talk about the schedule of prevention training that's going to happen in the schools, especially now that things are opening up. And for certain, I'm sure that this upcoming school year is going to be face-to-face.
Yep, so part of our general fund, our small amount of general fund appropriations, one of it is specifically for that mental health first aid training, which is an evidence-based training put out by the National Council for Mental Health Wellbeing. So like the director said, during the closure of the schools, or at least when people weren't face-to-face, we did put a pause in that. And then when we were ready to open, the National Council actually put a pause in it as well because they were converting to this new platform, which was a virtual training, and then they were taking the new data based on everybody's effects from COVID and adding it into this new curriculum. So for the last maybe 8 months, our current Guam behavioral trainers were recertifying, if you will, and now Guam has been chosen to be part of a pilot program for the nation to add on new curricula, which will include for veterans, public safety officials, fire and EMS, as well as higher education. And so all of that will be an added cost, but not to fret because the $280,000 is sufficient, and so we're not asking for more than that. But now there is a per person cost, which will be about $30 per person for the regular certification, and then there's an added fee for any special certification like the 4 that I mentioned for veterans and such. After we pilot this program, Guam will be a part of the evaluation, and the National Council will take our results and our input into consideration when finalizing the curriculum before they roll it out nationally. And so that's part of the prevention trainings that we're doing as well. As far as following the public law to train Guam Department of Education, we do have a training and education division now in the Guam Behavioral Health and Wellness Center, and our training officer is currently developing a calendar with the Department of Education to ensure that now that schools are fully back in session, hopefully the next school year we can implement what's called the teen mental health first aid in the classrooms, and then train the adults that serve in those schools.
Okay, that's great. So this is a brand new program, or at least it's a rehaul or over change of...
Correct. And they did that to incorporate all the new things that have come up during the pandemic.
So yeah, this is a big concern for me because, you know, we see rises in substance abuse in our youth, and that leads into the adult life. And I do want to encourage, you know, perhaps prevention. The more that we can put efforts in this area, I think it would go a long way.
I think in addition to the training, I think what's really exciting is the Safe Guam app that I spoke about. Because in general, I believe kids want to do the right thing, and there's just a handful of naughty ones. And so if they're be able to report them without anonymously, without being hit or targeted, I think that we can curb those kinds of incidents in the schools. So I'm really, really excited about the school app.
Okay. The other thing, okay, that's great. The other things, the lapses. Can you tell me how much do you estimate in lapses that you have currently?
For which fiscal year?
2021.
Pardon?
Well, I guess if you
ongoing?
Yeah, yeah.
Anticipated ongoing lapses?
Yeah.
455,000.
Okay. And so again, your focus was to spend all your federal grants down, and then that's why you have more of the local funding. Okay. And your intent is, do you expect to use this up for the programs that you have now before the end of the budget year?
We expect to spend everything we can.
Okay, and then this would go towards?
It depends. Maybe personnel, or we'll see where it's needed. Normally in lapses, we look where we need things that we didn't budget for, and then we use it within that fiscal year. But we are a health and human service field, so it's kind of easy for me to say most of our spending goes into personnel.
Okay. And then in regards to, is there a waiting list for those that are seeking substance abuse treatment? And, you know, perhaps using that money, can that money be used towards intake or more services, direct services?
The services, we're constantly servicing people. I mean, they just come to the office or come to the front door and we do intakes. So that's just part of our everyday work. Intake workers or social workers, every day is a different division that handles the intake so that they can experience the full complement of what a patient goes through, other than just catching them at their counseling side, but they know them from the beginning. So it's not necessary to use money to do intake because it's part of the social work that we do.
What is the estimated population for those that have addictions on Guam? Do you have an estimated amount?
You mean an estimate of how many people are addicted?
Yeah, based on what you are serving.
Based on how many we serve,
Yes.
I think it's safe to say that we serve a very small percentage. And why do I say that? Is because even though we're very, very busy and our numbers are growing and we're serving more people, the road to recovery is an individual choice. And until individuals have chosen to come and get help, we're not able to service them unless they're court ordered, which means they're in the system, the judicial system.
Are you seeing an increase in the ratio of youth to adults needing the services from Guam Behavioral Health?
I'm sorry, what is your question?
So I was just looking at the numbers about the amount of individuals
Client
that are
served?
served. Yeah, client served, youth versus adults. I think that might have been on.
I think COVID has really just grown the numbers parallel in both populations.
Okay.
I mean, there is an increase in children that need services, and there is also an increase of adults that need services. I think what COVID has done is those who are struggling with addiction have used, if they didn't come in for the proper kind of help during the pandemic, they turn to what they're comfortable in comforting them, which unfortunately is their substance abuse. So I can say that it's both populations have increased parallel of needing services.
Okay. And then in regards to the crisis hotline, what is the funding source for that?
Project Aga'hågan. So Aga'hågan in Chamorro means call.
So is that local funding or federal funding?
It's federally funded. And in the past, prior to the pandemic, the crisis hotline was always established, but you probably heard it more during the holidays, like the holiday crisis hotline. And that was especially driven by volunteers, but throughout the year, it was a collateral duty of our nurses. There's no way that we're going to go there. It needs a dedicated staff that's properly trained 24/7. The nurses are really busy in the units, and they're not able to answer that call and give the proper attention to the caller that needs help. So this is dedicated staffing for the hotline.
Okay, maybe one last question. So in regards to federal grants, can you compare the amount that you received from last year?
Oh, I don't have that. I need to look at last year's presentation, but I don't have, I mean, it's kind of different because it's not the same grants, right? So we apply for different grants. But I would, do I recall? 24 million. I think last year's federal funding was slightly 3 or 4 million less, but it's in the 20 million plus, if I recall correctly. Sorry, I don't have that.
Okay, yeah, I just was thinking about also the makeup of the federal funds, because what I'm seeing is that a lot of it is COVID related, a big portion of that. So the change, I guess the change in services that you provide, of course has to be eligible for the grant that is being provided. But it seems that, what COVID did, it exacerbated the conditions already, what we're experiencing in the community. And I guess it's my hope that whatever grants that you apply for and get can help really address that. And of course, I'm appreciative that you are going out for the expansion grants too as well. I think that anything that you can do to help bridge those gaps, greatly appreciate it. Thank you so much. Thank you, Mr. Chair.
Thank
Be
you,
rest
Sen-
assured, we'll continue to be aggressive in grants.
Thank you, Senator Patterson. Thank you, Therese. I know you're very aggressive when it comes to not only grants, but everything else you're doing. and your deputy director is probably like, yes, she is. But it's good. It's for the people of Guam. And I thank my colleagues for participating on this budget hearing this afternoon. The committee will conclude this budget hearing with the Department of Guam Behavioral Health and Wellness Center. The committee will continue to receive testimony. And please address your written testimony to the Committee on General Government Operations, Appropriation, and Housing, and submit it via email to Senator Joe S. Agustin at gmail.com or to my office, located at Rand Care Building, 2nd floor, Suite 3, 761 South Marine Corps Drive, Tamuning, Guam. Since Marcy for your attendance and participating in today's hearing, Ms. Ariola, and her deputy, and her ASO. And for those at home, thank you for watching. This budget hearing on Bill 276-36 COR relative to the Guam Behavioral Health and Wellness Center is now adjourned at 3:46 p.m. Please be safe and take care. Thank you.